Hi friends, welcome to our YouTube channel One and Only Pharmacy. So friends, in this video we see detailed notes about suppository chapter with explanation. Subject Pharmaceutics second, D Pharmacy second year. Let's start. Topics covered under this video. Which topics we are covered in today's video? They are as follows. Definition of suppositories and pessaries, advantages and disadvantages of suppositories, shapes of suppositories, classification of suppositories, suppository base and its qualities, and last point, method of preparation of suppositories. Let's see one by one in detail. Definitions. What is suppositories? Suppositories are solid or semi-solid bodies. Suppositories are solid or semi-solid bodies suitably shaped containing medicament for insertion into the body cavities. For insertion into the body cavities like rectum, vagina and urethra. These are called as suppositories. They melt at body temperature. Pessaries. Pessaries means suppositories intended for vagina are called as pessaries. Suppositories intended for the vagina are called as a pessaries. Next definition, buggies. Suppositories intended for the nose and urethra are called as a buggies, are called as nasal buggies and urethral buggies. That means suppositories used in nose are called as nasal buggies and suppositories used in urethra are called as urethral buggies. These are the definition. Next point, advantage of suppositories. What are the why suppositories are prepared? These are follow. They are used to treat local infections like hemorrhoids in rectum, that means piles, and infections of vagina. When oral administration of drug is not possible in case of infants, unconscious patients, or patients suffering from vomiting, nausea, the suppositories are useful because suppositories are used in other cavities, not in oral cavities. They provide fastest onset of action than oral rate. They save the destruction of drug in GIT because we don't take a drug in GIT route. They are unit dosage form, therefore there is no dose variation. These are some advantages of suppositories. Next point, disadvantages of suppositories. What's the disadvantages? They should be stored at freeze conditions, otherwise their shape may be disturbed. Absorption of drug through rectum is irregular. Patient does not like this route for drug administration. Administration requires a skill. These are the four disadvantages of suppositories. Next one, shapes of suppositories. There are five shapes of suppositories. First shape, cone shape. Their shape is like a cone. Second, bullet shape. This looks like a bullet. Third, a torpedo shapes. This look like a torpedo. Wedge shapes. This looks like a wedge. And last one, cylindrical. These are the five shapes of suppositories, namely cone shape, bullet shape, torpedo shape, wedge shape, and cylindrical shape. Classification of suppositories. There are five suppositories according to their route of administration. First, rectal suppositories. Second, vaginal suppositories are also called as a pessaries. Third, urethral buggies. Fourth, nasal buggies. And fifth, ear cones, that is orinaries. These are the five types or classification of suppositories. Let's see one by one in detail. Rectal suppositories. They are used for rectum. In their name, rectal suppositories means that are used in a rectum. General weight is 1 or 2 gram. They are either cone or torpedo shape. This is all about rectal suppositories. Second, vaginal suppositories. They are used for vagina. General weight is 4 or 8 gram. They are either cone or wedge shape. In vaginal suppositories are also called as a pessaries. We seen before. Urethral buggies. Third point, urethral buggies. They are used for urethra. They are long, thin, and cylindrical, usually 1 gram in weight and about 8 centimeter in length. Second types, nasal buggies. Nasal means nose. They are used for nasal cavity. They are about 9 to 10 centimeter long and 1 gram in weight. They are always made with glycerogelatin base. Fifth, ear cones, orinaries. They are used introduction into ear. They are long and cylindrical. They usually contain lubricants and anti-inflammatory drugs. These are the five types of uh, suppositories. Second point, suppository base, also called as a suppository vehicle. The definition: the vehicle or carrier used in the preparation of suppository is known as a suppository base. We also call as a adjuvant vehicles, etc., for use in the suppository. The vehicle or carrier used in the preparation of suppository is known as a suppository base. Ideal qualities of suppository base: this follows: it should melt at body temperature, it should release medicament readily, it should be compatible with added medicaments, its shape should not be changed during handling, it should be non-toxic and non-irritant to the mucous membrane, it should be stable on storage, it should be easily moldable or compressible. These are the seven ideal qualities of suppository base. Should be made at body temperature, should release medicament readily, should be compatible with added medicaments, should not be changed during handling, should be non-toxic, non-irritant to the mucous membrane, should be stable on storage, should be easily moldable. Second, types of suppository bases. First, fatty bases. Example of fatty bases, suppository bases: theobromo oil or cocoa butter. B, water soluble or miscible. Example, glycerogelatin base, soap glycerin base, and microalcohols. These are the types. Various methods of preparation of suppositories: cold handling, shaping, cold compression, fusion, heating method. These are the various methods of preparation of suppositories. In next video, we see detail about methods of preparation of suppositories like cold hand shaping, cold compression, fusion method, etc. So thank you guys for watching full video. Do like, share and subscribe our YouTube channel for pharmacy related daily videos. Let's see once again what we studied in today's methods of preparation of suppositories. There are three methods: cold hand shaping, cold compression and fusion method. We see in detail about in next video. Types of suppository bases: there are only two types: fatty bases and water soluble miscible bases. Ideal qualities of suppository base. So what is suppository base? It is a vehicle or carrier used in the preparation of suppository is known as a suppository base. Or five types of or classification of suppositories. Air cones, also called as ordinaries, these are used in the introduction into the air. Nasal buggies, they are used for nasal cavity. Urethral buggies, they are used for urethra. Vaginal suppositories, they are used for vagina. Rectal suppositories, they are used for rectum. Classification of suppositories, there are five types: rectal, vaginal. Vaginal suppositories are also called as a pessaries, urethral buggies, nasal buggies, ear cones, also called as ordinaries. Shapes of suppositories: cone shape, bullet shape, torpedo shape, wedge shape, and cylindrical shape. Disadvantages of suppositories, advantages of suppositories, and there are definitions. Main part of this subject: suppositories are solid or semi-solid bodies suitably shaped containing medicament for insertion into body cavities like rectum, vagina, and urethra. They melt at body temperature. Pessaries means it is the suppositories but used in the route of administration is vagina. Buggies means nasal buggies or urethral buggies. These are the simple definition. In today's video, what point we are cover: definition of suppository and pessaries, advantages and disadvantages of suppositories, shapes of suppositories, a classification of suppositories, suppository base and its qualities, method of preparation. There are three methods, but into the next video we see in detail about method of preparation of suppositories. Thank you guys for watching this video till the end.